Thank you to everybody that's joined us today for this session of the North Central Farm and Ranch Stress Assistance Center webinar series. It's presented to you by the National AgrAbility Project. And our topic today is on stress issues among migrant and seasonal farm workers. My name is Paul Jones. I'm the manager of the National AgrAbility Project, which is housed at Purdue University's Breaking New Ground Resource Center. Our presenters today are Esmeralda Manuano from California AgrAbility, which is located at the University of California, Davis, and Kimber Nicoletti Martinez, who is here at Purdue also. She works with the National AgrAbility Project in addition to other organizations. A little bit of background on the USDA National Institute of Food and Agriculture's Farm and Ranch Stress Assistance Network, which is commonly known as FARSAN. It was first established in the 2008 Farm Bill. However, appropriations did not come until the last couple of years for that. The main focus is to assist anybody in agriculture that's dealing with stress issues. And there are 4 regional centers that cover the entire United States and all the territories. If you want some basic information, including how to contact the directors of those programs, you can look on the agrability.org website under resources and then FARSAN. Again, this webinar series is presented to you through the National AgrAbility Project. And for those that may not be familiar with AgrAbility, we are sponsored also by the USDA's National Institute of Food and Agriculture. And our focus is on assisting people in agriculture that have some type of disability. Every one of the AgrAbility projects around the country is a partnership between a land-grant university and at least one nonprofit disability services organization. And currently there are 21 state projects around the country. Again, there's one National AgrAbility Project, and our main focus is to assist those other state projects and also to provide some limited services to people who live in states that do not have AgrAbility projects. Our partners on the National AgrAbility grant include Goodwill of the Finger Lakes, Osteoarthritis Action Alliance, AgriSafe Network, Colorado State University, and Washington State University. There's much more information about AgrAbility at agrability.org, including over 100 other archived webinars that cover a wide range of topics. So at this point, I'm going to just give you a little bit of background on our presenters. I won't read their entire bios, but our first presenter is going to be Esmeralda Manuano, and she is with California AgrAbility, as I mentioned. She's the program manager. She's been working in this area for over 10 years, and she focuses primarily on networking and outreach for California AgrAbility. She's also very involved in the Western Regional Agricultural Stress Assistance Program. Kimber Nicoletti Martinez, again, works at Purdue University. She's the director of the MESA program, which stands for Multicultural Efforts to End Sexual Assault. She's been working with the farm worker community for many years. She was also National Association of Social Workers, Social Worker of the Year, National Social Worker of the Year in 2018, and the 2017 Indiana Social Worker of the Year. And she works with both the National and Indiana AgrAbility projects. So I'm going to turn things over to Esmeralda and make her the presenter at this point. She's going to be sharing her screen, and then I will go ahead and mute.
Thank you, Paul. As Paul mentioned, my name is Esmeralda Mandujano, and I am with the California AgrAbility out of the University of California at Davis. And in today's webinar, I will be focusing on the intersection of farm worker, occupational, and mental health. So Although I will be discussing farm worker issues as they pertain to physical and mental health, I'd like to mention that in this presentation is by no means a full representation of the complexity surrounding farm worker mental health. There are countless psychosocial factors that have profound impacts and that will not be addressed in this presentation. So some of the learning objectives for today's presentation are to learn about the impact of musculoskeletal disorders on farm worker mental and behavioral health. Then I'll briefly look at environmental stressors, then dive a little bit into workplace psychosocial factors, and talk about solutions and resources to reach and assist farm workers experiencing stress. In this section, I'm going to focus on workplace interventions and also looking at promotores who are trusted community leaders as potential solutions. You'll see that in the slides, whenever I speak of a solution, this icon of a triangle will pop up to signal that I'm referencing a solution, because those are going to be sprinkled throughout the presentation. And although in this webinar, we are presenting potential solutions that can provide some relief to help farm workers in times of stress, it is important to recognize that an ideal solution would come from collaboration across different levels of individuals working with farm workers and different organizations. This graphic of an inner circle is a social ecological model, and it represents the relationships and the environments that surround and impact individual farm workers, from the interpersonal relationships all the way up to societal norms and policies. So again, I just really wanted to highlight that when I do speak of solutions, it's by no means a full solution. Like I said, it might provide some relief, but there are a lot of factors that have an impact and have an influence on the overall outcome, which would be a mental illness or a chronic illness in individual farm workers. And although I've mentioned that there's a lot of different factors that affect farm workers, I want to, before I dive into the presentation, really mention that although there isn't a lot of research in farm worker populations, this research is actually very scarce, but these are some important highlights to mention. For example, physical injuries. Farm workers suffer physical injuries on a daily basis. And they also work through musculoskeletal discomfort and illness. And there are a lot of barriers that they face when seeking care. Some of the most common ones tend to be language barriers, transportation issues, and also access to healthcare. Psychiatric distress from acculturative stress is something that has also been documented. And farm workers are injured on the job 7 times more likely to be, farm workers who are injured on the job are 7 times more likely to be depressed. And depression and nervios were found to be 5 times and 2 times more likely among injured farm workers. And when we talk about nervios, what we mean is that nervios really represent the physical and emotional pain that may arise from family poverty, legal status, gender roles, rural background and social isolation, and other stressors. And it is often expressed as anger and powerlessness. Nervios has also been significantly associated with stress and depressive symptoms in Latinos. So while farm workers sometimes described as low-skilled or no-skilled, a low-skill or no-skilled job, the nature of this occupation really requires dexterity, speed, skills, endurance, and really a lot of mental acuity. Agriculture is also one of the most hazardous industries in the United States. And in the United States, we have an estimated 2.5 to 3 million farm workers. In California, there are over 400,000 hired farm workers. About 90% of farm workers in California were born in Mexico. And the average wage annually for farm workers nationwide is about $12,500. Only 5% of migrant workers have health insurance. And in California, most of the 350 crops that are grown here require labor-intensive practices. So when we talk about labor-intensive agriculture, what is it? Well, it really includes various types of agriculture with higher levels of input and output per unit of agricultural land area. So what that means is that it requires a great deal of labor relative to the capital to obtain substantial agricultural produce. So that really involves a lot of heavy physical labor in order to harvest, in order to plant. Cotton harvesting was one of the most labor-intensive crops in the United States, but since it was mechanized, mushroom and strawberry harvesting are now the most labor-intensive agriculture types in the United States. So as a result of labor-intensive agricultural work, farm workers often experience various physical injuries and illnesses. Musculoskeletal disorders are the most common of all occupational injuries and illnesses in farm workers. And nationally, musculoskeletal disorders are the most common injuries in the production of fruits and vegetables. Back pain is also most commonly seen, is one of the most commonly seen symptoms, musculoskeletal disorders, injuries in agricultural workers. And in California, strain and sprain are the most disabling injuries. They represent 31 to 43% of injuries in the state. Also, musculoskeletal disorders the rates are near or above traumatic injuries that arise from respiratory illness, pesticide-related injuries, and dermatological injuries. So sometimes in the news we'll hear that there was a pesticide spill and 15, 20 workers were injured from that spill. So these are things that we may hear in the news, but when it comes to musculoskeletal disorders, we often do not hear this in the news because they tend to be slowly progressive illnesses. If we look at the priority risk factors for musculoskeletal disease, we can really look at them from two different angles. If we look at the physical risk factors, we see that there's a lot of stooped postures. So oftentimes when we see photographs of farm workers, we will see them stooped, bent, and these positions are really not natural body. They defy anatomical nature of the body. Bodies are not made to be bent, especially not for longer periods of time, like farm workers endure as they're picking or harvesting or doing the work that they need to do. There's also a lot of heavy lifting and carrying, and there's a lot of rapid hand movement work. For example, if you look at a worker who is working in a vineyard, the clipping motion that they do when they're pruning, that can happen 15 to 20,000 times in a shift, and that's just average. A lot of these workers work by piece rate. So what that means is that they get paid based on how fast they pick, the quality of the fruit that they pick. So it really can become a very competitive area where they're working because there's a lot of competition of who is the fastest worker, who has the fastest crew, that kind of thing. It's also another example of this competitiveness I can bring up is that in the Napa Valley, there are different vineyards that have a competition to see who has the fastest workers. And although the workers see it as a point of pride, if you look at it from an occupational standpoint, you can really think how much are these workers really pushing their bodies in order to be that fastest worker. I have met several of these workers, and one of them once told me he was extremely proud that he had won the Golden Shears that year. So these are points of pride, but at what cost to their bodies? There's another point here with competitiveness is that the average age of a farm worker now, according to the National Agricultural Worker Surveys, is about 39 years old. Similarly to the age of farmers, it's also going up. So what that shows us is that a lot of the workers who are established here are not really, there's no new workers going in. So what happens is that we see a rise in the number of H-2A workers or imported workers that come into the United States. And that creates another level of competition between the older workers and these H-2A workers, which tend to be younger, healthier workers. So this can be a source of a lot of stress for the workers. If we look at the psychosocial, cultural, legal, and mental factors, we see that most of the workers currently come from Mexico when they have limited education. Although they mostly speak Spanish, many also speak indigenous languages such as Mixtec, Zapotec, and about 50 to 80% of them are undocumented. The reason why this range is so large is because it's difficult to really know, right? Because a lot of those workers do not want to be seen. They're hiding because if they are deported, they can no longer provide for their families. So that's why these numbers are the range is so large. Also, the National Worker Agricultural Surveys in 2009 noted that 9% of agricultural workers experience elevated depressive symptoms. 8% of this 9% were men and 17% were women. And among male agricultural workers in California, 22% were found to have symptoms of nervios. So living in pain, suffering in silence, and resisting until your back gives out is a sad reality for millions of Latinas in the United States. Hasta que Dios me dé vida y la espalda aguante, until God gives me life and my back holds. This is something that is not, it's actually super common to hear this in my work with AgrAbility. I often hear comments like this of workers who have sustained injuries, and they are still working through the pain of their bodies. In this photograph, we also see 47-year-old AgrAbility, after 26 years of agricultural work, many years suffering from musculoskeletal symptoms. She sustained a back injury. And as you can see in this photograph, she is using a chair to do her cooking. And that's because of the amount of pain that she is feeling. Again, also on my site visits, when I do my work for AgrAbility, it's not an uncommon sight to see some of the workers use things such as a chair to aid themselves in completing the work that they're doing. A quote from AgrAbility says, "I come to my house, and when I am alone, I lie in my bed to wallow in pain and cry." And in this quote, I really want to highlight this part, when I am alone. Because although poor mental health is regarded as a stigma, it seems to be especially apparent within the Latino culture. Latina women, for example, are more likely than white or Black women to endorse feeling embarrassed about discussing personal issues, fearing what others may say, or believing family members may think they are crazy. Okay. So interventions at the workplace are a way to provide some sort of help or relief for workers. Common types of interventions include reducing or eliminating known risk factors such as stoop postures, mechanical worker protection or worker aid, training or administrative controls, regulations and laws, and also familial and community support. An example of an administrative intervention is a study that was conducted by Dr. Fatala, who is the director of our AgrAbility program. What he did is he looked at two different crews of workers. One had an hourly break for their lunch. The other one had had a reduced lunch for 30 minutes, but then they also had 3 to 5 minute breaks throughout their workday. This totaled 20 minutes. The study showed that the workers that were having 3 to 5 minute breaks around the workday showed significant decrease in reported symptoms, and they also experience relief in the pain and also psychological pain. There's also no decrease in productivity. And this point is extremely important because when you look at agriculture, agriculture is an industry, it's a business, it needs to be productive. So some of these interventions are often tied, successful interventions are often tied to the productivity of the farm. So the productivity of the farm needs to be tied to the well-being of the worker. That is the solutions that reach being implemented in large farms tend to exhibit these characteristics. In the Davis Enterprise last year, there was Davis Enterprise is a local newspaper here in Davis. There was a farm worker woman quoted saying, "We're exposed to everything: chemicals, fire, harassment, COVID-19. And working through these extremes can extreme conditions can cause stress on the mind and on the body. Workers are often seen working through the pandemic, and in the pandemic they experience fear of whether or not they may catch this illness and whether or not they can even make it out alive on the other side of the illness. With the heat, there's increased risk of heat illness, and it can also lead to workers sleeping less, and therefore they have less rest and increased stress. With the fires, agricultural workers can struggle through the stress of wildfire smoke. And with rain, there's an increased risk of slips and falls. And the workers are aware that they're working in an environment that is dangerous. So not only are they working quickly to pick when it's raining, they're also at the mercy of being exposed to a higher risk of falling. Okay, another factor that greatly impacts farm worker health includes psychosocial factors related to their work. For example, when workers come to work seasonally, a lot of social and cultural isolation occurs in these communities. The photograph on the right is a photograph from a migrant center here in California, and these migrant centers are often situated in rural, isolated areas. So that contributes to language and cultural barriers. And although, yes, there is a positive to living in communities that know each other, it also increases the fact that they're isolated from the rest of the communities. There's also a lack of health resources, and especially a lack of mental health resources. And there was a study that showed that among agricultural workers, the frequency of substance use was linked to the type of work, as some of the crop work and harvest is much more physically and mentally demanding than others. So another factor that greatly impacts farm worker mental health is workplace sexual harassment. According to the Equal Employment Opportunity Commission, unwelcome sexual advances, requests for sexual favors, and other verbal or physical conduct of a sexual nature constitutes sexual harassment. This is a topic that has gained more attention over the last few years. For example, PBS put out this documentary called Rape in the Fields, and I think that was one of the things that put a lot of attention on this topic. But when you look at research in general in terms of workplace sexual harassment, there isn't a lot. And when you type in there agriculture, there's even less research available. But this is an important paper that I have constantly been referenced to, and especially because of the title. They talk like that, but we keep working. And what this shows us is that oftentimes women and really every agricultural worker think that this is part of the job. Like, you just have to continue to work because these things are going to happen. And it shouldn't be that way, right? It shouldn't. And for that reason, universities like the University of Washington have started to put up some curriculum. For example, they have a training called BASTA, which means Stop, Prevent Sexual Harassment in Agriculture. If we look at prevalence of workplace sexual harassment, we see that exposure is directly tied to position and power. There was a study in the California Central Valley that showed that 8 out of 10 farm worker women experience workplace sexual harassment. So as you can see, this is a very high number. Okay. So if we look at the consequences of workplace sexual harassment for the victim, we see that there are a lot of consequences. If we look at the psychological consequences, victims suffer from PTSD, anxiety, depression, suicidal ideation. If we look at the psychological consequences, there are headaches, GI disorders, sleep disturbances, emotional exhaustion, high blood pressure, suppressed immune system function, and inflammation. And if we look at the physical Consequences, there are rape, injuries, spread of STDs, and unwanted pregnancy. There's also consequences for the crews. The crews tend to experience lower productivity, performance, reduced employee recruitment and retention, increased absenteeism, work and job withdrawal, reduced job satisfaction, damage to goodwill, and inter-team conflict. And there's also consequences for the organization, which are mostly seen as cost, legal fees, increased sick leave cost, and negative publicity. In California, a recent law requires all employers of 5 or more employees to provide 1 hour of sexual harassment and abusive conduct prevention training to non-supervisory employees. And this is very important because a lot of these trainings often are designated or done just for the supervisors. But what this does is that it provides information and knowledge to the workers who may be vulnerable to experiencing workplace sexual harassment. And individuals like Dolores Huerta and Milly Treviñas have said that really serve as advocates for farm worker justice. For example, Dolores Huerta has spoken of workplace sexual harassment as a hazard of the job. And leaders like this have played an important role in making regulations like this a reality. So what these two have in common, Milly and Dolores, is that they also really embody the role of a promotor. They embody the role of being a trusted community leader and being able to be a trusted communicator between the workers and also organizations. And they also give rise to some of these groups, such as the Alianza Nacional de Campesinas and the Líderes Campesinas, which are advocacy and promotores groups that are very active directly with farm workers. I also want to mention that the researcher that did this work on workplace sexual harassment in agricultural workers, one of the great things that she did was that she not only came up and did the research, she also developed tools from her research. One of the things that she did was she developed a cuento, which kind of tells a story of a family that experiences workplace sexual harassment. So you see you see the story of a family and how it affects the entire family. It affects men and women and everybody at some level. And what she did is that she created this cuento, and instead of keeping it just written, what she did is that she also turned it into an audio. And that is very important because a lot of the farm workers often cannot read. So some of these cuentos can be broadcasted on the radio and reach more of the workers. So we're talking about advocates and promotoras. Promotores, like I said, play an important role in farm worker health. They are trusted community leaders who serve as a bridge between their community, institutions, and social service agencies. And they are recognized as effective cultural brokers, cultural and language brokers, relationship builders, referral experts, advocates, peer educators. And with this and understanding of the value of the work promotores do to support farm worker health, the Western Regional Agricultural Assistance Program, us at the California AgrAbility, and the Western Center for Agricultural Health and Safety at UC Davis are currently working on a research to help organizations build community-based partnerships with existing promotores groups for farm worker outreach. This is a photograph of a training that we held in 2018, in which we held workshops to train community leaders to become promotoras. And in that training, we also included a lot of topics that had to do with agricultural health and safety. Also, promotores have gained recognition as the cornerstone of comprehensive farm worker healthcare, especially during the pandemic. In California, we're set for a major expansion of community health workers under Medicare, Medi-Cal in California. So this is an exciting opportunity that really highlights the value of promotores. Lastly, I would like to invite you to participate in our next Western Regional Agricultural Stress Assistance Program Network Quarterly meeting. This will take place on October 14th, and if you scan the QR code on here, that will take you directly to the registration. Or my coworker Angelina is going to be dropping in the chat a link to the flyer and to the registration. In this meeting, we are set to have Montana State University's assistant professors, Dr. Grokey and Dr. Brennan, to share their findings about their agricultural producer baseline survey and also share recommendations for RASAP partners and agencies providing services to farmers experiencing farm stress. Lastly, I would like to thank the USDA National Institute of Food and Agriculture for funding our AgrAbility program. Also thanking the National AgrAbility Program and the North Central Farm and Ranch Stress Assistance Center for inviting me to present in their webinar series, and also extend my thanks to the team at Western Regional Agricultural Stress Assistance Program for inviting me and trusting me to work with them on this very important topic of farm stress in ranchers and farm workers.
Well, thanks so much, Esmeralda. Appreciate all that valuable information. If you have questions, again, please feel free to enter those into the chat area. At this point, I'm going to turn things over to Kimber and make her the presenter. Actually, I need to switch that back real quick. Okay. Now I'll make Kimber. Okay, Kimber, I think you're ready to go.
All right. Thank you so much, Paul, and thank you, Esmeralda. That's a tough act to follow. That was really some incredible information. And it is great to be here with you all this afternoon. I am new to working in this role with AgrAbility as the Latino Outreach Coordinator, but I'm not new to working with AgrAbility. I've been collaborating with them over the past several years, doing outreach with farm workers in the state of Indiana. And most of the work that I'm talking to you about today really comes from my experience as a clinical social worker, doing mental health services in fields and camps and in clinics with farm worker populations. So we'll move on here. I could tell you a joke. What did the duck say when it bought lipstick? It said, "Put it on my bill." So as Esmeralda was talking about from a workplace standpoint, I'm looking at it from an interpersonal sources of stress, although certainly you can't really completely separate these things. So in addition to work-related sources of stress and mental health, farm workers are also vulnerable to other types of stress and mental health issues. And some of these are unique to farm worker populations, but others are similar to sources of interpersonal stress experienced by general populations. So like one of the things you see listed here first is family problems. So family problems could be looked at from a variety of terms. They can be family problems experienced by all families, but however, family problems can also be related to family separation due to extensive amounts of traveling required for work for farm workers that travel as part of that. Additionally, under that same thing has to do with this idea of relationship issues. Spending large amounts of time can create additional stressors on relationships, which may increase some of those feelings of loneliness and isolation, which can lead to increased risk for infidelity or increased use of drugs and alcohol to manage those difficult feelings. And we also know from research that social isolation has been found to be connected with feelings of increased anxiety. So, and in my 20 years in my work as a clinical social worker, I see that most of these sources of stress intersect in the lives of farm worker populations. So one of the things that we do in exploring stress and mental health when we conduct support groups Due to cultural norms around mental health, we typically start out facilitating an arts-based activity and ask people, what is a healthy family, or what is a healthy relationship? And we ask them to draw. Sometimes we ask them to act it out, just depends on the space that we're working in, what that looks like to them. And so then each person has the opportunity to share. And frequently what I see in these farm worker groups are pictures of families holding hands, flowers, churches, sometimes word, a lot of times food. And these drawings help us understand how they view health, how they view family, how they view, the concepts of those, what do they look like? So the pattern that emerges a lot has to do with the connection to family, connection to faith, and connection to home. So in doing this work, I found that usually we want to do something, we want to put the framework for the work that we're doing that not directly frame it around stress or mental health issues, because as Esmeralda was talking about, there's a reluctance or some cultural taboos around discussing these issues. So additionally, in some farm worker communities, there are different understandings of what health and what mental health is and how that's considered. So I want to tell you the story of a woman named Margarita. And interestingly enough, Esmeralda, what you don't know about this picture that you see on this slide is this was actually taken for me by Millie Trevino Sauceda when we were working together to create a photonovela. But so there was a farm worker woman who presented at the clinic complaining of pain in her legs and stating that she had cancer. She was rubbing the legs saying, oh, I have cancer, I know I have cancer. And so I asked one of the doctors if they would see at the clinic to see her. And so after a really short visit, the doctor said, well, we need to refer her to an oncologist. And I started talking to him because really she hadn't had any tests yet. So there was sort of that cultural disconnection there between what she was saying and the doctor's understanding of what should be done. But she was just sure that she had cancer in her legs. But Margarita did not have cancer, but really she was dealing with, in the American medical model, of what would be called acute stress, acculturation stress, and an adjustment disorder. So, but how she was experiencing it was a holistic feeling of pain in her legs. So there are farm workers who experience stress and mental health with symptoms such as loss of appetite, decrease of sleep or weight, rumination, feelings of helplessness, worthlessness, overwhelmed. But it's important to consider other symptoms that may be relevant to culturally affirming concepts of mental health, which may not fit into categories that you might use in the United States in terms of looking at a survey to address mental health issues. So in these, in addition, after we draw the pictures of what people see as a healthy family or what they see as a healthy community or a healthy relationship, then we start having a conversation about how do you know that if you're not healthy. And so we get a lot of people talking about, well, people have a temperature, you might have a cough. So then in that exploration, we further delve into, well, what would be some other symptoms of other kinds of health besides like a cough and a fever and things like that. So some of the things that we look at have to do with drug and alcohol use in the home, or family violence, or problems with anger, or maybe someone who's not participating in family activities. Some of the other things, because in general, we see that there is usually a large emphasis on connection with community, la comunidad and la familia, but when you see someone who becomes withdrawn or maybe not participating, then that's something a lot of times in the groups that we use that as a springboard to talk about stress, to talk about interpersonal issues, and to talk about how to cope with feelings. So I'll move on to the next slide. Here we go. So we know that farm workers have increased risk factors for stress-related issues and mental health issues, but we also know that there's underuse in the population overall of mental health services. And farm workers are particularly vulnerable to mental health problems because they've often, as Esmeralda was pointing out, work in isolated and remote areas with very limited access to resources or services. I've visited numerous places where the local community had no idea that there were farm workers in their area. So, and in many of these places, there are limited or no accessible or culturally appropriate mental health resources in general, for anyone. So, and as once again, as Esmeralda pointed out, that farm workers are some of the poorest people in the United States, and so they often experience lulls in income or lulls in employment. I've certainly received a call from a woman this week who was in the northern part of Indiana. She showed up, she had 2 kids. She thought there was work. And then because she had the 2 kids with her and because of the COVID situation and COVID protocols with farm worker housing, she wasn't allowed to take her kids into the farm worker housing. So, it was a person that there she was. She didn't have any resources. She didn't have money. She didn't have transportation. So, and if there are resources, farm workers may not be able to afford it, or it may not be available during the hours that they could receive help, which is something that we run into a lot. And then another risk factor has to do with documentation status. It's a barrier for many farm workers. So whether someone is undocumented or working on a work-related visa or an H-2A visa, many farm workers and immigrants lack understanding of their basic rights. So they often are fearful of deportation or arrest. I can't pass through this part without saying that we know research tells us that discrimination and bias in many communities is a barrier for them to seek help for many things. I'm reminded of several years ago, there was a farm worker community and there were children that were in need of vaccines. And I was trying to find a provider who was willing to vaccinate farm worker children, and it wasn't a matter of cost. That part was covered, but we couldn't find a healthcare provider in the community who was willing to vaccinate the farm worker children. So it was where we saw, like, even in a medical setting, that there was some resistance and bias towards providing services for the farm worker community. So, instability, isolation, and lack of access to critical services really means that people are more vulnerable in these communities. One of the things that I found helpful in talking with healthcare and mental health care providers about learning to provide services for farm workers is to understand the concepts of help seeking. In the community, with values such as personalismo, familismo, where connected to the family matters, personal relationship matters, that there is an emphasis on informal help seeking. I can tell you in my family that we had a store for many years that we went to for everything. You went to the Mexican store and they knew how to find this. You needed a dentist, you went there. And so it's this idea of people are used to seeking help from someone trusted in the community, maybe an informal community leader. I think that's where the promotores really serve as a great function in communities. It follows that traditional informal model of help seeking, as well as looking at traditional models of health and the approach to health, like the use of curanderas and natural medicine. In many communities, regardless of how many generations back, maybe it's something that someone's grandmother said, and they'll still want to find services that are related to that. So this idea of going into an office where you have some crumpled magazines and there's someone sitting behind a desk doesn't really match to what their concept of help seeking would look like, as well as the role of faith and how people feel like oftentimes we see people, such in the case of victims of sexual assault or sexual harassment, that don't want to go seek help because they feel like that God will handle it, or perhaps that it's something that they have to bear for the sake of the family or for the sake of the community. So, as previously was mentioned, we've talked a lot about the taboos around mental health, but also the idea around gender role issues. A lot of farm worker communities have traditional gender roles, and so that might be where the father or the male is the person that sort of endorses something. And so a lot of times if you get in a community and say the husband doesn't say, well, yeah, let's go for counseling, or he's resistant to it, that can also create additional struggles. Something that I frequently do is I make sure that I'm pulling in, if we're dealing with a woman or we're dealing with children, that you're pulling in the father and making him part of the decision making in terms of how you're going to approach that. And of course, we already talked about the importance of the familia, the comunidad, and of the faith and cultural concepts of mental health. We don't have enough time today to go into detail about those things, but it's certainly something that's important in your effort to explore if that's something that you're looking at farm worker mental health in your community, or something that you're looking at working with partners to develop increased access. Now, one of the things that becomes a challenge, I think, for anyone, but even more so for the farm workers, is the idea of that struggle with work-life balance. And we've conducted a lot of focus groups with farm workers, and a common theme that arose was the conflict of the high value placed on la familia and the number of hours or time spent working and traveling that kept the family apart. So whenever we started addressing things like family problems, and if you talk to people and start trying to explore what they would see as a solution, they really always felt most of the time that the solution lied between the parents educating the children. But then the challenge becomes what we see here a lot is sometimes children stay with other family members when mom and dad might come up here to work for the season. And so how do they meet those needs? Or a lot of times we also see where they start getting things from school when children go to school, and sort of these expectations. And that becomes an additional interpersonal stress for family, that now I'm supposed to have a science fair project. I should read so much a day with my child, and yet, working till 8, 9, or 10 o'clock at night and having to be up at 4 in the morning. And really looking at ways to alleviate stress. That's one of the things that we talk about. You have to find things that are easily accessible for people that are working those kind of hours. And I would be amiss if I don't mention the fact that many immigrants come with a history of trauma. And we know that that just sort of builds a layer for them, a foundation which further complicates their ability to cope and deal with stressors. When we see people that have a history of trauma, which can be from war, it can be from domestic violence in the home, it can be from rape or sexual assault in the immigration process, we know that that makes it more challenging to cope with, healthy coping, stress relief, to manage emotions, as well as it impacts the ability to develop healthy relationships, which are known as a buffer or stress relief when people experience large amounts of stress. And that history also affects other also impacts other choices that a farm worker may make along the way. Now, this thing that you're seeing here is not specific to farm workers. It's from Capacitar, but it is specific for people who have experienced harm. So what are some things that we can do to address this? You know, one thing starts with developing culturally affirming care with farm workers to create avenues to improve mental health and for coping. And an important place to start with that is with culturally sensitive health and mental health services. You know, one of the things that we've done to help mental health service providers to develop the capacity to effectively serve the farm worker community is really look at increase their cultural understanding of health and mental health, and really look at how organizations are providing services and where services are being provided. So in creating access, you know, it's a good idea to look at farm worker clinics. Right now I'm involved in a pilot project this year called Healing Voices, and it's being piloted in Florida and California, and it's facilitated by licensed mental health clinicians and is delivered via Zoom. So this allows participants to utilize their phones, and they can participate in support groups where they, you know, are learning things about talking about feelings. And it's an effort to look at different ways to create access. Other things might be mobile clinics, or really, you know, having clinicians do direct visits to camps is a great idea as well. And I always want to talk about the importance of framing the issue. It's really in exploring how to increase access. You know, how is it being framed? As we know that many farm workers might have a synergistic view of health, meaning that there's a connection between spirit, mind, and body. And also remembering there's, in many farm worker populations, there's an oral history of the culture. And so different kinds of storytelling or arts is a great way to create that connection. And that's some of the approaches that we use is arts-based. We do a lot of teatro campesino, where we do like theater-based storytelling and helping connect the dots. At the same time, looking at understanding the cultural context. But something that we encourage people to do, if you're able to do that, is to screen everyone. And I would encourage that. We had a farm worker suicide this week. And it was tragic for this young man. And he had a brother who was a farm worker that committed suicide last year. So it's something that's really, really important that we look at stress and mental health issues in farm worker communities. And I just would like to say that even if you can't do something big, you know, some of the things like with Healing Voices that we're looking at is just teaching simple breathing exercises, looking at opportunities for community connection and support. One of the things I usually ask farm workers when we're doing the pláticas is I talk about what alleviates stress, because it's not going to be yoga, it's not going to be walking, because they've certainly already exercised enough that day. But a lot of times they tell me things like their faith or talking to someone or music or showering. So, and also look at what support you have available in the area, and you know, what kind of education that's available that would be culturally appropriate on mental health and stress. And I just want to leave you with this, some resources that are available in Spanish and English: the National Suicide Prevention Helpline, the Mental Health American Crisis Center connection. You can text it, you can call it, the National Sexual Assault Hotline, as well as the Trevor Project, which is the leading national organization providing crisis intervention and suicide prevention services to LGBTQ youth. So thank you so much. I know that There's so much more that we could talk about, but I appreciate your time. I appreciate being invited to participate in that and all the great information that Esmeralda shared with us. So I'll turn it back to you, Paul.
Thank you, Kimber, for, again, more excellent information. I want to make sure we have time for a couple questions before we wrap up. So I'll read the one we've got in the chat right now, but before I do, I would like to point you to the chat area for the link to our evaluation survey. It should take you less than 30 seconds. If you could click on that and just give us some feedback, that definitely helps our future program planning. I think this question could be for either Kimber or Esmeralda. I'll read this from Dan Baker. What strategies do you suggest given the challenges of meeting mental health needs of farm workers? Here in Vermont, we have a shortage of mental health resources generally, and even more mental health services with appropriate cultural and language resources. Is there evidence that short-term interventions are useful? So I would open that up to both Kimber and Esmeralda for any comments that you have about that.
I think I can answer the first couple parts. Kimber might be more appropriate, might have a more appropriate answer for the third question. I would say that facing the shortage of mental health services is something that is very common, and it is also one of the reasons why we often partner with some of the existing promotores groups, because they can help you expand and reach some of these populations closer, and also provide some of the services that may only be available at some clinics. So training promotores, training some of these advocates can help you reach and provide some help. That's one of the things that I've seen has worked best.
And I'm just following up. Because there's such limited data that's available on mental health and mental health services in farm worker populations, I can't say that there's evidence that short-term interventions are useful, but I do know that we understand when you look at resilience, and that would be something that you might consider is how can you increase resiliency, and that would have to do with how can you start having these conversations about small coping skills. What kind of connection can you find in the community? I know a lot of times there aren't culturally specific mental health resources in a lot of communities. And much like Esmeralda was saying, is we try to partner with other, sometimes like, Catholic charities or different faith-based organizations. And a lot of times in those faith-based organizations, people will have training around counseling and mental health services. They might be providing a lot of ongoing different kinds of support that you could tap in. We had a Catholic organization here that they were doing a lot of organizing with other service providers to provide that kind of crisis support, especially during COVID. So I would definitely say that's worth trying. And I know that in general, yes, I agree with you, Dan, that there is a need for increase in mental health resources as well as, culturally specific ones. So thank you. That was a great question.
Kimber, unfortunately, we had a little bit of a connectivity problem, and I think some of your answer got a little garbled. I don't want you to have to repeat the whole thing, but maybe if you could summarize a couple of the main points, and maybe if we went ahead and stopped our videos, that might help our connectivity also.
Sure. Sorry about that. Now I'm trying to remember. I'm at that age. I don't know if I can remember exactly what I said, but that there is limited data on whether short-term interventions in this population are useful, although certainly I have been trained in short-term solution, brief solution focused therapy with other populations. So, but I definitely think it's worthwhile looking at who you might be able to partner with in the community. They might not be specifically designated as a mental health provider, but you might find people that have training within different organizations that are trying or would be interested in supporting that effort, and really doing anything you can to really support resiliency in the farm worker population, I think would be worthwhile.
One other question I see here, how have programs reached out and involved the farm owner to support farm workers? And I guess connected to that is, do you see an interest and willingness from the owners and growers to be a part of this process?
I can speak a little bit to that. The factor with involving some of the farm owners is that you have to take into consideration that there is power dynamics, and also the farmer is also has a lot of stress, right? Running a farm is extremely difficult, and adding on to that, taking care of your workers on more of these deep levels can be more work for them. And also, I have learned of some programs that have worked directly with the farmers. Some of these have been funded through universities, where they create health and safety programs for their workers. So there is some of that going, but there's also usually the preferred method is to go with community agencies or community leaders that can directly talk to the workers and educate them and provide some of this information. So it's a little bit more complicated, but there are some initiatives that have worked directly with the farmer. One of the most successful ones that I've seen is with implementing vaccination at farms for COVID-19. I think this is one of the first times that I have seen more of that unification of taking care of the farm health and also the farm worker health. And I'd also have to mention that traditionally farm worker health and farmer health have been bifurcated. So you usually have they're mostly seen like two separate roads, but we're also working towards combining that and saying, how do you take care of the farm, and also how do you take care of the farm worker, and at the same time working for improving the health of both the farmer and the farm worker.
And I just would add to that in Indiana, we've certainly had farmers and growers who were more than willing to participate. Red Gold is one of those places that we've had a great relationship with them in the College of Agriculture at Purdue. They're always very interested. We've actually gone in and taught sexual harassment, mental health, parenting classes, all, outside of their farm worker housing. And they were very supportive of it, as well as they would participate in trainings about farm workers. But certainly I think it varies from farmer/grower, depending on that. But I do think it's important in supporting agriculture and farmers that you develop that relationship so that they understand that you're not there to create additional stressors for them, as Esmeralda mentioned.
Okay. Well, again, thanks so much to everyone who participated today, both those that attended and our presenters, Kimber and Esmeralda. I see no more questions in the chat, and we're a little bit over our projected time. I would point you again to the survey. If you could take 30 more seconds, we'd appreciate your feedback. And we look forward to more webinars in the North Central Farm Stress Assistance Network series. If you registered for this one, you will be on the list to receive information about future ones. So with that we say thank you again, and we wish you a good day.